All right, hello, thank you. My name is John Gordon from the Consumer Product Safety Commission. I'm a toxicologist there. Thank you for clicking on the video and watching this presentation. It's on CPSC's regulatory decision framework relevant to carcinogenicity. Let me give you a little background on CPSC. CPSC is an independent federal regulatory agency that was formed in 1972, and its mission is to protect the public against unreasonable risk of harm, injury, or death, which is good for consumer products. We do this through education, safety standards activities, regulation, and enforcement. We do this because of numerous deaths, injuries, and property damage from consumer products that cost the nation about $1 trillion each year. CPSC has jurisdiction over thousands of types of consumer products used around the home, schools, and recreation, other settings, child-resistant packaging, including household chemicals, drugs, and cosmetics. The packaging part is of those as well. I mean, several products are of course not in CPSC's regulatory realm. Such as automobiles, planes, boats, tobacco, firearms, drugs, cosmetics, pesticides. Those are all regulated by other folks. We have a staff of about 550 people, budget about 150 million. We have 5 commissioners that are appointed by the president who make most of the decisionals for major rulings that come down from CPSC. And at the bottom, you'll see several, we see 3 helpful links that I recommend checking out. The recalls.gov, you can sign up for an email that gives you a recall on products. I highly recommend that. It's been very helpful for me. I've had a couple of products recalled that I owned. What does CPSC do? We develop, issue, and enforce mandatory consumer product safety standards or bans. We recall products for repair, replacement, or refund. We research potential product hazards. We develop voluntary standards with standard organizations, manufacturers, businesses, and other stakeholders. We inform and educate consumers directly through traditional online and social media. We're working with foreign, federal, state, local, and private organizations. We also educate manufacturers worldwide about our regulations, the supply chain integrity, and development of safe products. Here are some CPSC regulatory statutes. And there's numerous statutes that we follow, but these are ones that more deal with carcinogenicity. The CPSA established the agency and its general procedures. The PPPA, Poison Prevention Packaging Act, has to deal with childhood-resistant packaging. The FHSA is one of our main statutes that we follow, rules that we follow. It has to do with chemical hazards, often addressed by FHSA. Other hazards are also identified, mechanical and others. And LAMA, as we say it, Label of Hazardous Art Materials Act, special requirements for art materials, and it also addresses chronic hazards. The FHSA defines hazardous substances. I'm not going to go through all of this for you, but basically it looks at toxic materials, corrosive, irritants, strong sensitizers, and other problems too that don't have anything to do with carcinogenicity. But it deals with substantial personal injury or illness due to foreseeable handling or use of that product, ingestion by children and such. There are several things that the FHSA does do. It considers exposure and risk, and not just the presence of a toxic substance. It regards consumer products as mixtures. CPSC does not regulate discrete chemicals like EPA and FDA do. It requires products to meet the definition of a hazardous substance to bear cautionary labeling. It authorizes the commission to ban hazardous substances through rulemaking if the labeling does not adequately address the hazard. it can be used to ban a hazardous substance. Substances, toys, or other articles intended for children's which contain an accessible hazardous substance. Like I said, we look at the not just the presence, but the actual accessibility of the hazard itself. It defines toxic and hazardous, but we do not define non-toxic or non-hazardous. And it includes both acute and chronic effects. There are several things that FHSA does not do. The FHSA does not require pre-market approval, require manufacturers to perform toxicity tests, require manufacturers to provide ingredients to CPSC, and it does not require manufacturers to list ingredients on the labels of consumer products, except for hazardous ingredients. CPSC also has an animal testing policy. If you go to the website listed here, it's a fantastic reference for all the animal and non-animal testing policies that we have. And CPSC does encourage the use of alternative validated methods to animals and existing information in order to do assessments of chemicals. And please go to that website, and that will give you much more than what that little clip that shows you for the animal testing policy. Example of FHSA health hazard assessment at CPSC. We determine whether a product could be a hazardous substance. We make decisions on a case-by-case basis, considering the chemicals, product characterization, the consumer's use and behaviors as well. We perform a risk assessments looking at hazard identification, dose response evaluation, exposure assessment, risk characterizations, and we work in interdisciplinary teams, including toxicologists, pharmacologists, exposure scientists, chemists, human factors engineers, and statisticians. So it's a team effort when we look at something as far as whether or not it's a hazard. It's not just one group looking at it. There are several risk management options available to CPSC. We can inform and educate the public. We can use voluntary and or mandatory labeling and performance standards. We can recall a product or ban a product. When we ban a product, we use something called a CHAP, Chronic Hazard Advisory Panel. It's required before certain mandatory regulations for carcinogenicity, which is what we're here for, also mutagens and teratogens. It's required by statute, and basically what they do is they provide a report to the commission on the product and its ability to be a carcinogen, mutagen, or teratogen. And then the commissioners make a ruling based off of that. The chronic hazard guideline. This is a great resource for information on needs for identification of carcinogenicity. Most of the information is here. Some of it's in FHSA, some of it's in LAMA, but there's the link here for the chronic hazard guideline itself. Then we just about a month ago, we put out a supplement to the chronic hazard guideline. I highly recommend downloading both of these PDFs. Major sections are on carcinogenicity, neurotoxicity, reproductive, developmental tox exposure, bioavailability, risk assessment, acceptable risk. But would definitely recommend downloading both of these PDFs for a better understanding of how we handle carcinogenicity. I'll go into a little bit here too. CPSC's regulatory risk approach to carcinogenicity. I have basically 2 slides here on this. We have several documents to help you with this, such as the FHSA, Chronic Hazard Guidelines, and LAMA, which I've mentioned before, which outlines CPSC's approach to carcinogenicity risk assessment. Evidence of carcinogenicity can be used in a variety of regulatory measures, such as labeling, recall, or ban of the product. Evidence of carcinogenicity largely comes from 2 sources. Currently, human epidemiological data and animal studies, but CPSC also uses and encourages the use of modern approaches for non-traditional sources such as new approach methods and such. And studies can be supplemented with available with information from short-term studies. CPSC regulatory risk carcinogenicity, get a continuation on the same topic here. The criteria for determining carcinogenicity is applied through expert technical judgment. A lot of agencies have a set procedure for determining carcinogenicity. We do not. There is no set procedure for making a determination of risk of harm to perform and we use several options, and it's all on a case-by-case basis. Determining whether art materials has potential to produce chronic adverse health effects, including carcinogenicity. The toxicologist shall take into account opinions of various regulatory agencies and scientific bodies as part of FHSA. And we look at all biological mechanistic endpoints of carcinogenicity. We don't just look at any one type. We're interested in any form of carcinogenicity for our consumer products. For evidence of carcinogenicity, the chronic hazard guideline defines evidence as sufficient, limited, inadequate evidence, as well as possible carcinogen. If you're interested in these concepts, please read through the chronic hazard guideline or contact me here at CPSC. More than happy to go through these with you. If I went into these individually, it would take the entire 20 minutes of the time allotted. So I'm sorry I wasn't able to go into these in greater detail. The FHSA and chronic hazard allow for flexibility evaluation on a case-by-case basis. Source of data should be based on good sound science. The study quality is very important, and we examine details such as the test was well designed, well conducted, statistical significance, and route of exposure is very important for CPSC. And for a summary, evidence of carcinogenicity can come from human epidemiological data, NAMs, and/or animal studies. Studies should be well designed, well conducted, demonstrate statistical significance, and have an appropriate route of exposure. The criteria for determining carcinogenicity is applied through technical expert judgment on a case-by-case basis. For further information on determination of carcinogenicity, please look at our FHSA, LAMA, or the chronic hazard guidelines for more information. They're fantastic information that I would recommend downloading and keeping these documents in your library. And thank you very much. Here's my contact information and several very good links to go through and see what we do here at CPSC and how to contact us. So thank you very much for watching, and have a great day.